video will demonstrate draping of the abdomen for surgical procedures such as a laparotomy, bowel resection. We have our scrub nurse here. She's going to be applying the first square drape. Notice how she's approaching the patient, ensuring that she's covering herself and protecting her hand as she's applying the square drape. She's going to take the second square drape and she's going to hand the second drape to our resident here, who will then approach the patient to apply the square drape. As she applies the drape, she's careful to protect her hands, preventing contamination of her glove. The last drape is a laparotomy drape. The scrub nurse removes all the adhesive tape, looks for the hole in the drape, and there's also a man drawn on the drape that tells the scrub nurse the orientation. You always want to make sure the head of the patient matches the head of the person on the drape. That's the orientation that you will be using. As she applies the drape, she applies a bit of pressure on the abdomen to ensure that the adhesive is applied correctly. She gives one end of the drape to the resident, and they drape the bottom of the patient's body, and then they unfold the top. The top of the drapes will be clipped onto the IV pole. Now they've established their sterile field. The scrub nurse then wheels over the Gerhardt table with the assistance of the circulating nurse. Here, the circulating nurse is adjusting the height of the table to ensure that the patient's foot is not directly pressed against the table. Here, the scrub nurse is then unraveling all her cords. One cord is the suction and the other cord is the electrosurgery unit cord, more specifically the monopolar cautery. Once the cords are secured in place, she will then use the extension of the Gerhardt table She places towel clips to secure the extension of the Gerhardt table cover. For the beginning of surgery, the first instruments that are given to the surgeon, it's usually some sponges, a blade, forceps, some snaps, ribbons, and a section is also there. She'll also use a marking pen as well with a ruler. Now they're ready for surgery.